Welcome to another edition of Nurse Minute. My name is Brenda Marks, and it is my pleasure to introduce Susan Girolami, Clinical Manager for iHeal Company based in Cincinnati, Ohio. Sue brings over 30 years of experience as a certified ostomy nurse and is an expert in wound care. Sue has an extensive background in clinical research and is involved with the Association for the Advancement of Wound Care, where she co-chairs the guideline department. We are thrilled to have Sue join us today.
Well, thank you, Brenda, for the opportunity to share my experiences in the world of wound care.
We have some interesting questions for you. Sue, I guess starting off, basically, we frequently hear the term support surface, but how would you define the term?
The term support surfaces is a very broad interpretation. It's a specialty device, and it can be indicated for either a bed or a chair. It is also powered or non-powered. It's essentially made for the purpose of reducing tissue load and tissue stress through redistribution of pressure.
Okay, and how important are support surfaces to patients in different care settings, such as acute care, long-term care, or even hospice?
You know, Brenda, we find that high-risk patients exist across the continuum of care. So that would be inclusive of acute care, subacute care, long-term care, home, hospice, assisted living, ERs, community dialysis centers. I mean, the list just goes on and on. Anywhere, basically, there is a patient, there is potential for pressure ulcers, and it's related to altered mobility, spontaneous movement, and increased tissue vulnerabilities.
So, Susan, what is the biggest issue you see contributing to healthcare-acquired pressure ulcers?
Brenda, it's important that the proper equipment is available and that the selection criteria for support surfaces is a valid process. And that we look at doing things that have clinical efficacy or clinical outcome-driven data rather than just cost-based purchasing, so that we understand that when we selected any kind of equipment for either the bed or the chair, that it has meaningful use for the person it's chosen for.
What are the implications of these healthcare-acquired pressure ulcers?
So if we assume that a patient is placed in an environment that is less than optimal, and the result is that they develop a pressure-induced injury, then what we find foremost is that the pressure ulcer creates undue patient suffering and pain. And if I can use my brother as an example, he actually had developed a sacral ulcer when he went in for an open heart surgery, and that was a lingering problem for him long after the surgery itself. So if you ask him his opinion, he actually suffered more from that pressure ulcer than he did from the open heart surgery itself. And of course, hospitals and all other healthcare entities worry about litigation related to pressure ulcer development, their reputation, because people usually talk about the results. And they also have issues with non-reimbursed cost, additional cost, extended stays, medical resource use above and beyond what they intended to treat the patient for.
So, Susan, what should hospitals be doing to prevent these sort of situations from happening?
So foremost, if we wanted to look at pressure ulcer prevention, we would want to identify the high-risk areas that exist in our given health arena and the high-risk patients that are within that area as well. We want to monitor our pressure ulcer incident and then analyze what perhaps is behind that in terms of how a patient is positioned or the environmental contributors. And then select devices that provide reliable offloading for the population that you serve in your individual healthcare arena.
So how important would it be to maintain these support surfaces, and would it follow you could probably afford more expensive equipment if you look after what you have?
And of course, it even makes it more important, in fact, maintaining that surface, because you wouldn't want to have to replace it if you'd paid a great deal for it. So monitoring support surface covers to ensure that their integrity is good is relevant actually in two primary elements. One is infection control and the other is cost. And of course, from a cost advantage, it is if I have an integrity break in my surface and body fluids, wound drainage would go into the core of that device, then ruining the device, making me have to destroy it and start over, that's a high cost. So if I maintain that and on a regular basis I inspect the surface and I repair any small defects, I make sure that I do not get any contaminants into the inner core of my product, but at the same time I'm managing infection. Because if the fluids ingress into the center core of your device, then if it's an air product, they're blowing through the air. If it's a foam product, they're festering and creating more bacterial load. So it's extremely relevant to really monitor the surface and make sure that the integrity of those products is maintained.
Okay, well, thank you so much, Sue. We really appreciate your time today, and I look forward to speaking with you again. And if anyone has any questions for Susan, please contact her via the email address on your screen. So thanks so much, Susan.
Oh, thank you, Brenda.